Assalamu alaikum. My name is MUNIRAH ALKHARJI and I'm here today to present my project titled Cardioprotective Effects of Carvacrol against Histological Changes in Doxorubicin-Induced Cardiotoxicity in rats. To start off, anthracyclines are a class of drugs used in cancer chemotherapy isolated to a mutant strain of the actinobacteria Streptomyces parasitaeus. Despite many recent advances in cancer treatments, anthracycline therapies including doxorubicin remain an essential component in the successful treatment of multiple types of malignancies. And a particular concern with doxorubicin is the development of cumulative dose-related cardiotoxic effects. In this context, Carvacrol, which is a phenolic terpenoid found in essential oils of oregano and other plants, had already been reported to exhibit beneficial effects including anti-apoptotic, anti-inflammatory, and antioxidant activities. Therefore, the plant-derived compound Carvacrol was studied here in the case of cardiotoxicity induced by doxorubicin. And we can move on to the research design. So 24 male Sprague-Dawley rats were split into 3 groups. The first group, which is a control group, was administered with corn oil for 14 days and 0.5% of DMSO on day 15, while the second group, which is the cardiotoxicity group, was administered with corn oil for 14 days and 1 dose of 50 milligrams per kg of doxorubicin on day 15. Lastly, the third group, which is the treatment group, was pre-treated with 50 milligrams per kg of Carvacrol for 14 days and 1 dose of 50 milligrams per kg of doxorubicin on day 15. On the 19th day, the rats were anesthetized and sacrificed. Then heat chaining and precursor staining were performed on the left ventricle to detect hypertrophy and fibrosis, respectively. The first objective: for systolic blood pressure, within the groups, there was significant difference between dox group and day 0 and day 18, and between dox group day 14 and 18 with a p-value of less than 0.05. Between the groups, there was significant difference between dox group and control group, and between dox group and Carvacrol dox group on day 18 with a p-value of less than 0.05. Moving on to the second objective. These microscopic images represent the comparison of collagen deposition by using precursor staining in the perivascular area of the left ventricle heart section. There is extensive fibrotic damage of the dox group compared to control and card plus dox group. While this graph measures the area percentage of fibrosis, there was significant difference between dox group and control group and between dox and card plus dox group with a p-value of less than 0.05. Moving on to the third objective. These are the representative images for all groups. For the dox group, as you can see, here is evident wavy degeneration of cardiac muscle fibers, as well as coagulative necrosis of myocardial hemorrhage and vascular congestion. On the other hand, the Carvacrol dox group has shown some degree of coagulative necrosis and wavy degeneration of cardiac muscle fibers. This graph measures the cardiomyocyte hypertrophy that occurred in each group. There is significant difference between dox and control group with a p-value of less than 0.05, and there is significant difference between dox and Carvacrol dox group with a p-value of less than 0.05. Moving on to the discussion. First of all, doxorubicin-induced cardiotoxicity is strongly linked to an increase in cardiac reactive oxygen species by targeting the mitochondria in the heart, leading to extensive oxidative damage to myocardial cells. The irreversible loss of myocardium leads to myocardial infarction, which eventually leads to left ventricular remodeling process, which occurs very rapidly in the immediate post-infarction period within 1 to 2 days. In the initial phase after myocardial infarction, remodeling results from fibrotic repair of the necrotic area with scar formation, which is considered as an adaptive response. However, beyond this stage, the remodeling process is mainly driven by cardiomyocyte hypertrophy in the non-infarcted area, and all of these changes result in progressive decline in the ventricular performance as well as loss of contractility in the left ventricle, which causes a reduced blood pressure. It is suggested that Carvacrol was able to prevent oxidative stress damage by its antioxidant properties, which prevent free radical-induced tissue damage. In conclusion, pre-treatment of rats with 50 milligrams per kg of Carvacrol for 14 days showcased cardioprotective effects.